Well, I think there's a number of reasons going on here. First of all, Europe was amongst the first countries in the world to vaccinate. The UK was ahead of Europe by about 4 to 6, maybe 8 weeks. And we've seen our vaccine waning in recent times, and that's why we've started the booster campaign. I think in Europe, the waning of the initial antibody response, our vaccine response, was delayed a bit, so you're seeing cases now. During the summer, you had relatively few infections across many European countries, whereas in the UK we had a lot, so we've got a lot of the boost to immunity going on in the UK, which hasn't happened in many European countries. Interestingly, if you look at Romania has got a very low vaccine uptake, but it had a very, very high epidemic of coronavirus a few weeks back, but already you're seeing pretty dramatic falls in case numbers in Romania. So it's a balance here between immunity from the vaccine and immunity from prior infection, and the two working together to bring down case numbers. And in many parts of Europe, you haven't got the immunity from natural infection at the moment. Looking at Sweden's has done pretty well in recent months, but they've had a lot of infections earlier on. So it's a bit of a seesaw, really. I mean, anything that you do to control COVID will have some effect, and I'm sure this move will have some benefit. You've already been told that people are now coming forward for vaccine that previously wouldn't have done. But I think it is a very blunt instrument to control this, and ultimately whether it has much benefit or not, I guess, depends on how well it's implemented, how well it's measured and maintained. And to a certain extent, there are other interventions that may well be more powerful, like helping and identify cases and ensuring that people who are infected are self-isolate, which would have would be more effective than just this sort of general blanket ban, I think.